When I was growing up, we didn't have a chickenpox vaccine, and I don't think my daughter would ever realize how blessed she is that there's a vaccine now, and she doesn't even have to have a disease that many of us have had in our childhood.
It is one of the more recent vaccines to join a growing list that has mostly eradicated many infectious diseases. Chickenpox for today's generation will join polio, measles, and many other diseases as something they just don't have to worry about. But every once in a while, an outbreak will return to the front page.
After the measles outbreak, which got a lot of press, international and national press, when you're looking at from a systems and population level, you look at to see who are the unvaccinated people, right? Who are the groups of, and we have several groups. There are people who are ineligible for medical reasons, and then there's a whole group of people who have religious personal belief exemptions.
Those personal belief exemptions had been growing over the years so much that by the 2013-14 school year, in San Diego County, 4.5% of kindergartners had them. Statewide, the percentage was growing too, which, when combined with the outbreaks, led to passage of a new state law. And that law is now in effect for this back-to-school season.
SB 277 passed last year. It eliminates the ability to have a personal belief exemption. From now going forward, only medical exemptions will be allowed. We're living in a time where vaccines have been so successful that we actually don't even see many of the outcomes of the diseases they protect us against. So it's human nature to question why we need this, why are we putting something in our body. I don't blame anyone for thinking that, but at the end of the day, you know, science has proven over and over and over again that these are very safe and that they're safer than the diseases that they protect us against.
The state law has many parents scrambling to get their children vaccinated, but if your child currently has a personal belief exemption, it's not until that child enters either kindergarten or 7th grade that they will need proof of vaccination.
For parents who are wondering where to get their child immunized, I would first recommend, you know, their medical home and remaining with their usual provider. If you don't have enough time before school starts, you know, there's always the options of some pharmacies now have some clinics. And then for those uninsured, we have public health clinics as well that do immunizations. So they can go to our website, SDIZ, and find out where those clinics are. It's never too late to get vaccinated, and vaccines nowadays are purer than they've ever been before. There's no data to show that there's anything wrong with providing multiple vaccinations in one day. So it's never too late to catch up.
In the County News Centre, I'm Dominic Fulgoni.